Good
morning, everyone. We'll call the Joint Committee on Consumer Protection and Health. Used to be one committee at one time, and that was really crazy. To order, we have a couple of, actually we have four, I believe, resolutions on our agenda. Health is the lead on the last one, CPN is the lead on the first one. And in the unlikely event that we have to abruptly end this hearing due to technical difficulties, the joint committees will reconvene to discuss any outstanding business at 1:30, April 20th in conference room 224, and a public notice will be posted on the legislature's website. If there are any temporary glitches, when it's your turn to testify, we may have to move on to the next person because we have a finite amount of time to conclude our business this morning. And we'll be reading a list of individuals who submitted written testimony for each measure. If the closed captioning makes a mess of your name, we apologize. So let's see, for the CPN committee, we have Vice Chair Chang. I don't see him with us. We have Senator Detroit, Senator Nishihara, Senator Riviere, Senator San Buenaventura, and Senator Favela. Chair, would you like to introduce your committee members?
Yes, thank you. And for the Health Committee, it's myself, Vice Chair is Senator Baker. We also have members, Senator San Buenaventura and Senator Favela.
So let's go forward with our first HCR. This is HCR 33, requesting the auditor to conduct a social and financial assessment of proposed mandatory health insurance coverage for early access breast cancer screening. We have written testimony only from the Department of Health, offering comments. We have testimony from the Hawaii State Center for Nursing. Is Laura here? Welcoming my Vice Chair, Senator Chang. Is there a representative from the Center for Nursing? If not, we have testimony and support. Am I on the right one? No, I think I'm not. HCR 130. Oh, I jumped down, sorry. I jumped down to 139, my apologies. We had testimony on HCR 33, Department of Health, and we have from the Hawaii Medical Association. Is HMA here?
Yes, we are, but we stand on our written testimony, Senator.
Okay, thank you. Anybody else here wishing to offer comment on HCR 33? If not, members, any questions for HMA? If not, Chair, I'm passing it over to you.
Okay, thank you very much. The next measure is HCR 139. This is HD1, requesting the Department of Commerce and Consumer Affairs to conduct an analysis regarding the scopes of practice for advanced practice registered nurses and physician assistants. First up, we have Laura Reichart, Hawaii State Center for Nursing. Okay, Board of Nursing.
Good morning, chairs, vice chairs, and members of the committee. The board, Chelsea Fukunaga for the Board of Nursing. The board will stand on its written testimony offering comments. Thank you.
Thank you very much. Hawaii Medical Board.
Good morning, Chair, Vice Chair, members of the committee. My name is Shelley Choi. I'm testifying on behalf of Alani Kioki, the Executive Officer of the Hawaii Medical Board, and we'd like to stand on our written testimony providing comments. Thank you.
Okay, thank you very much. That's all the live registered testimony we've received. Is there anyone else who would like to testify on this resolution? Okay, seeing none, I'd like to note we have supporting testimony from the Disability and Communication Access Board, testimony in opposition from the Hawaii Association of Professional Nurses, comments from the Healthcare Association of Hawaii, Wendy Gibson Viviani in opposition, Wailua Brandman in opposition, and Ann Scharnhorst in support. Members, any questions?
Sure.
Senator Favela.
Professor, you call nursing.
We have the Board of Nursing.
Yeah, the Board of Nursing. That's
Ms.
fine.
Fukunaga?
Thank you.
Hi.
Oh, I wasn't sure, so you're supporting this, resolution?
I'm sorry, Senator. It's very hard to hear.
I'm
Can you
sorry,
repeat your
my fault.
question? Sorry.
My fault, I didn't have the mic, my apologies.
Oh, okay.
Are you
Sorry.
supporting this,
So the
This
board doesn't have
resolution?
any opposition to this resolution, if that's what you're asking. I don't know about outright supporting it, but we don't have any opposition to conducting the study.
okay, thank you, please, thank you, Chair.
Thank you.
Members, any other questions?
Yes.
Senator San Buenaventura?
So, my understanding is that the House changed, the resolution, that instead of the auditor, it would be the Department of Commerce and Consumer Affairs. Does the Board of Nursing have any, position as to who is to conduct the study?
All I know is that the board isn't objecting to the DCCA conducting the study. I believe the board staff will conduct the study and work in conjunction with other interested parties.
Okay, is anyone else who is, online or present, testifying regarding this resolution have any position as to who conducts the study, whether or not the DCCA or the auditor? Apparently not. Okay, thank you very much, Chair.
Okay, members, any other
Thank you.
questions? Okay, seeing none, we'll move to the last measure on the agenda. This is HCR 66, House Draft 2, requesting the establishment of a telehealth and telephonic services working group to address the complexities surrounding the appropriate use of telehealth and telephonic services by specialty care area and coverage of these services by health insurance. First up, we have HMSA in support.
Good morning, chairs, vice chairs, and members. My name is Lindsay Garcia for HMSA. We are in strong support of HCR 66. HMSA is a strong supporter of telehealth and was the first health plan in the nation to provide a telehealth platform, HMSA Online Care. We believe the establishment of this working group is timely. The technology and understanding of appropriate use of telehealth and telephonic services has evolved over the years, so we appreciate your considering this measure. Thank you for the opportunity to testify. I'm available for any questions.
Thank you very much. Next, offering comments, we have the DCCA Insurance Division.
Morning, Chair, Vice Chair Ian Robertson for the Insurance Commissioner. We stand on our written testimony offering comments. Thank you.
Thank you very much. DHS in support.
Aloha, Chair, members of the committees. My name is Judy Moore Peterson. I'm the MedQuest Administrator. And on behalf of the Department of Human Services, we support the intent of this resolution. Comments. Thank you.
Thank you very much. Hawaii Primary Care Association with comments.
Hi, Eric Gabe for the Hawaii Primary Care Association. The HPCA does not believe this concurrent resolution is warranted since neither the enactment of legislation nor the adoption of a concurrent resolution is necessary for a standing committee to convene a working group. If a benefit is available under Medicare and Medicaid, shouldn't it also be required for private insurance? That is the question that this legislature must decide. The Senate has taken the position on House Bill 1980, Senate Draft 2, that yes, indeed, private insurers should be required to reimburse for audio-only telehealth services. And for that, the HPCA commends and greatly appreciates your support. Support for this concurrent resolution undermines the Senate's position on House Bill 1980, Senate Draft 2. It is a legislative statement that the bottom line for a single insurer, albeit the largest private insurer in the market, is more important than the accessibility of basic health care to some of the most vulnerable and isolated communities throughout the state. Thank you for the opportunity to testify. I'd be happy to answer any questions.
Thank you, Mr. Abe. And next we have Queens Health Systems offering comments.
Morning, chairs, vice chairs, and members of the committee. John Garibaldi with the Queens Health Systems. We will stand on our written testimony, providing comments and support. Thank you.
Thank you very much. That's all the registered testimony we received. Is there anyone else who would like to testify? Please come up.
Hi, yes, I'm gonna have to check. My name is Becky Gardner. I'm here on behalf of the Hawaii Psychological Association, the National Association of Social Workers Hawaii chapter, and also the Hawaiian Islands Association of Marriage and Family Therapy. We did submit written testimony. I hope you got it in your packets. All three of my organizations that I'm representing, we offer comments. These two committees, this is a reso about a working group, but these committees have done a lot of work on this proposal, and we've seen multiple measures introduced last session, this session, and HB 1980 pretty much has it down. It's gone through a couple of iterations, but we believe that the proposals in 1980, which pin audio-only definitions of telehealth on the CMS language, the federal, the work that the feds have been doing, there's no need to put state resources into exploring this area. The three considerations that this working group is tasked to explore is the research. And I'll note with HB 1980, I had submitted at the very bottom of the testimony 25 pages of the front page of abstracts of research that indicate the efficacy of audio-only telehealth. So the research has been done. The research has been evaluated by the Federal Department of Health and Human Services. And it's clear they're going with the CMS, they're going with audio only. And we think that private insurers should do the same. We shouldn't be in a position where our federal taxpayer dollars are funding health plans that offer this coverage and our private plans don't. Of the three considerations, the second is to look at the CMS guidelines. HB 1980 does incorporate the federal regulation that CMS had proposed. So we don't need to explore it further, it's already done. And finally, the third consideration is looking at the various coverage levels. And we believe that this is just a policy call. You have enough information. You made the call.
Thank you very much.
And we ask you to put your efforts into that.
Next testifier.
Thank you so much.
Yes.
Good morning, community members. My name is Kylie Swan. I'm a self-advocate with person with disabilities. I stand in support of HCR 66 HD2 because I can use phone for doctor's appointment. Thank you for allowing me to testify and answer any question that you may have. Thank you.
Thank you very much. Is there anyone else who would like to testify on this resolution? Okay, members, any questions? Okay, seeing none, Chair, do you need to recess or? Would you like to go into the end?
I'm fine going into the end.
Okay.
Regard to the resolution that was referred to CPN and health requesting a study for mandatory health insurance coverage for early access breast cancer screening. Chair recommends that we pass this with some technical non-substantive amendments. And I must add that quite frankly, as a woman, as a legislator, as a citizen, I am appalled that in this day and age, that there would be a need to do a sunrise study on a matter such as this. What does it say about our insurance coverage for women's health? To me, this is another example of gender discrimination, especially when early detection not only saves lives, but saves the health system dollars. However, I will recommend to my colleagues that we pass this resolution. And with that, any discussion, members? Chair votes aye.
Okay, Chair's recommendation for HCR 33 is to pass with amendments. Chair votes aye. Vice Chair Chang, aye. Senator DeCoit.
Aye.
Senator Nishihara.
Aye.
Senator Riviera.
Aye.
Senator San Buenaventura.
Aye.
Senator Favela.
Aye.
Recommendation is adopted.
Thank you, members.
Okay, Health Committee, same recommendation. Chair votes aye.
Chair votes aye. Vice Chair votes aye. Senator Moriwaki. Aye. Senator San Buenaventura.
Aye.
Senator Favela.
Aye.
Chair, your recommendation's adopted.
Thank you very much. Okay, we'll move to the next measure, HCR 139 HD1. This is requesting an analysis regarding scope of practice for APRNs and physician assistants. After reviewing the testimony, I'm not sure this resolution is necessary, so I'm going to recommend we defer. Any discussion? Okay, we'll move to the next resolution, HCR 66. This is regarding the establishment of a telehealth working group. After reviewing the testimony, hearing it here in the committee, I'm going to recommend that we also defer this resolution. If the legislation currently being negotiated this year doesn't pass, then we can always do a working group in the interim. Any discussion? Okay, seeing none, we're adjourned.